This video is about vaginitis, and vaginitis, the itis refers to inflammation, and inflammation of the vaginal mucosa. And I am going to present you with three different types: bacterial vaginosis, Trichomonas, and Candida. Before we get into these three, just basics about vaginitis in general. Very basics, as we just said. It's an inflammation of the vaginal mucosa, and normally you have in the vaginal flora an organism called lactobacillus, and this is the normal vaginal flora. This is the organism, and this organism exists in a range, a pH range, about 3.8 to 4.2, and it prevents the overgrowth of harmful bacteria. Now, this can be disrupted by a variety of reasons, and we'll get into all that. A lot of things. I mean, there's a long list. And if you do have a disruption of the normal flora of the vaginal area, you can have symptoms. And the symptoms most commonly are vaginal discharge. And that is the main predominant symptom. You can have other symptoms also, like pruritus and erythema, and sometimes burning and pain, and maybe even mild bleeding. But discharge is by far the most common. And the diagnosis is done by there's many ways, but the pH, measuring the vaginal pH, and doing a microscopic examination of the vaginal secretions with a wet mount. Wet mount is simply you take vaginal secretions and you put them on two slides, and then you apply some saline and you look under a microscope, and what you see under the microscope will distinguish which one of these three it actually is, if it indeed is a case of vaginitis. And then there's one other test that they do. You can also apply potassium hydroxide to the wet mount, and that can emit a odor. And because sometimes a case of vaginitis can produce amines, and those amines emit a characteristic fishy odor, and that can also help distinguish. So here we go. And the treatment, of course, is based on what type of vaginitis it is. So let's get started with each of these one by one. So BV, bacterial vaginosis, the first one. And bacterial vaginosis, also abbreviated BV, is really, it's an alteration of the vaginal flora. As I mentioned, the lactobacilli decrease, and they allow pathogenic flora to flourish, and that can happen for a variety of reasons. And there's several pathogenic bacteria that can cause BV, but the most common by far is this one, Gardnerella vaginalis. And there's other ones too, but this one is the most common. So, what are the symptoms? Well, before I get into the symptoms, one thing that you really need to understand is, why would this happen? What are some of the causes, risk factors? Well, bacterial vaginosis appears to happen for a wide variety of reasons, but some of them really are involved with anything that alters the mucosa, or anything that alters the normal flora that exist. And some of the risk factors, RF's risk factors, include pregnancy, IUD use, and frequent douching, women who douche frequently. So that's some of the reasons why this can happen. Now, let's get into the symptoms. So the symptoms basically involve vaginal discharge. But the type of vaginal discharge is gray, And this produces a fishy smell, this type of vaginal discharge. Okay, so now that's very non-specific, so you really need to do a test. And remember, I talked about that famous wet mount. And the wet mount basically is you take the vaginal secretions and you put them on a slide, and then you examine it microscopically. And when you examine it microscopically, you will see something called clue cells. And now picture speaks louder than words, so what are clue cells? Well, these are clue cells right here. These are clue cells. Well, that's what they look like. Now, what are they? Clue cells are bacteria that are sticking to these epithelial cells. Okay? And that's essentially a definition of clue cells. They're bacteria that adhere to the epithelial cells. And that's what they look like right here. And that's what you're going to see on the wet mount. Now remember, if you apply potassium hydroxide to that to the slides, this can help produce a smell, and that smell is known as a fishy odor, and that happens in BV. BV, the organism, when this is done, when this KOH is applied, it produces amines, and those amines can produce a fishy odor. So then how do you treat it? Well, the treatment is with metronidazole. Remember that. Metronidazole is the treatment for BV. Okay, so that is bacterial vaginosis. Now let's get into the next one, which is Trichomonas. Trichomonas. Trichomonal vaginitis. Trichomonas actually is very interesting. It's an STD. It's a sexually transmitted disease. So that's why it happens. Risk factors or causative factors. You can also get it with IUD use, but this is the real reason. So let's get into the symptoms. Well, again, like all types of vaginitis, what you're looking at is a vaginal discharge. And the vaginal discharge in Trichomonas is yellow-green. And it's also frothy. Now, this is a very important word. Remember this word. It's always on licensing exam. If you see frothy, it's Trichomonas. All right, remember that. And then sometimes you can see erythema of the cervix if you do a vaginal exam. Now let's get into the diagnosis. Just as before, you do a wet mount, which is a microscopic analysis of the vaginal secretions, and you will see a very characteristic finding, and that is you will see these motile trichomonads, and they may even have flagella, which are their tails. Well, let's show you a picture. Here they are, right here. These are the motile trichomonads. And this is what you'll see under the microscope. So get a good feel for those types of images. And what else can I tell you? Well, treatment interestingly is also with metronidazole, but you also have to treat the sexual partner. Why? Because it's a sexually transmitted disease. So you got to make sure that the partner is treated as well. Alright, now let's get into the third and final one, which is Candida. Candidal vaginitis. Well, the risk factors for this is actually very, very commonly tested. So remember these risk factors. Diabetes can cause this. Antibiotic use can cause this. You can get this if you've been taking steroids. Or sometimes even oral contraceptive use can cause Candida. Diabetes is a big one. Well, symptoms. Again, vaginal discharge, but the vaginal discharge is white. All right, it's a very characteristic white color. Most women can sometimes even self-diagnose based on just the type of vaginal discharge. And The diagnosis, again, is done with the wet mount, that famous wet mount we keep talking about, and you will see these yeast, because that's what Candida is. And in particular, you'll see these hyphae, and I'll show you what they look like. This is right here. This is a great picture. You can see the stems. You can see the little buds coming out here. You see little budding hyphae, they're called. And this is a very, very classic picture of a wet mount showing the Candida species or pathogen. So how do you treat it? Well, you treat it with an antifungal, because Candida is a fungus, and the most commonly used is fluconazole. And just remember, all antifungal medications have azole at the end. So if you see an azole in the answer choices, it's going to be the correct one. Well, I went through the three of them really to illustrate the key points, but I would like to make a little table, and I would like for you to remember this table, and if you do, you will most likely be able to answer all the questions on the licensing exams about these three causes of vaginitis. So the first thing I want to write is organism. What causes? Well, remember, BV is caused by Gardnerella. There's other organisms, but Gardnerella is the most common. Trichomonas, well, it's caused by Trichomonas vaginalis. And Candida is caused by Candida albicans. Alright, so those are the organisms. What type of discharge? Well, BV is a fishy discharge. Trichomonas is a yellow-green frothy discharge. Remember the word frothy. The R in trick and the R in frothy. Remember that. Candida is a white discharge. pH, vaginal pH. For BV, it's greater than 4.5. For trick, it's also greater than 4.5. But for Candida, it will be less than 4.5. The microscopic examination, or the saline wet mount. Remember that. What do you see? Well, you see clue cells here. You see the trichomonads, motile trichomonads. And here you see those hyphae. And let's see that diagram again. Well, you got your clue cells here. You see your hyphae here. And you see a trichomonas, trichomonads here. So this is bacterial vaginosis. This is Candida vaginitis. And this is Trichomonas. Trichomonas. Alright. There you go. Alright. Going back to our table. We got a couple more things in here. I think I can fit it all in. Next thing is a KOH. Remember, if you apply potassium hydroxide to the wet mount, this is also known as a whiff test. What will happen? Well, for bacterial vaginosis, it will be positive. You will have that fishy smell. And it will also be positive for Trichomonas, but it will be normal. Now, remember, some licensing exams, they will try to confuse you. They'll say fishy, and then they'll say the KOH whiff test is positive. But if it's positive, which one is it? Is it Gardnerella or Trichomonas? Well, don't get confused, because it could be positive in both, but there will be something in the question stem that will allow you to differentiate. For example, if they say frothy, it's always Trichomonas. I saw a licensing exam question that said fishy and frothy. One of those Trichomonas was the answer. Treatment, metronidazole. The treatment for Trichomonas is also metronidazole. And for Candida, it's any azole, like fluconazole, for example, fluconazole. And finally, one thing to remember is which one is the sexually transmitted disease. It's this one right here. No. Trichomonas is a sexually transmitted disease. So if you know this table of BV, Trich, and Candida, you should be able to answer pretty much every question on the licensing exam about vaginitis.